You wake up at 3 in the morning with a strange, heavy weight sitting right in the middle of your chest. Not sharp, not the clutch your heart and collapse moment you have seen 100 times on television. Just heavy, like somebody set a stack of books on your sternum and walked away. You tell yourself it is the pizza from dinner. You take an antacid and lie back down. That single decision, made in the dark, half asleep, is the decision that decides how much of your heart you get to keep. I'm Dr. Robert Lawson, 15 years of internal medicine, and if there is one pattern I have watched repeat itself in exam rooms more than almost any other, it is a patient sitting across from me telling me they knew something was wrong and they waited anyway, because what they felt did not match the movie. Here is why this matters so much after 45, and especially after 60. Heart disease is still the single most common reason adults in this country do not make it to see their grandchildren grow up, and the cruel part is that the warning it gives you is almost never dramatic. It does not announce itself. It shows up quietly at 3 a.m. in the shape of something you could talk yourself out of, and by the time it becomes unmistakable, the clock has already been running for longer than you think. So here is my promise for the next few minutes. I am going to walk you through exactly what a real heart attack feels like, because it is almost never what you expect. And then I am going to give you the handful of specific things you can actually do in the first minutes, the ones that genuinely change, whether you walk out of the hospital or spend your retirement short of breath walking to the mailbox. Watch for the fourth one especially. It has nothing to do with medicine, and almost nobody has ever sat you down and explained it, and it may matter more than anything else on this list. Before I go further, do me one favor. Down in the comments, tell me your age and whether you have ever had a chest scare you brushed off as heartburn or stress. I read every one of these, and they genuinely shape what I cover in future videos, because the questions people are actually sitting with are usually different from the ones I expect. I'm going to skip the usual thing I do here, which is tell you about a broader plan for the years ahead, because this particular topic does not deserve a pitch. This one deserves your full attention on the mechanics of staying alive. So let's get straight into it. To understand why the next few minutes matter as much as they do, you need 90 seconds on what is actually happening inside your chest, because once you see it, the whole plan will make sense and you will never forget it. Picture your heart as a hard-working pump, and running along its outside surface are its own private supply lines, thin arteries no wider than a piece of spaghetti, whose entire job is feeding that pump the oxygen it needs to keep beating. Over years, a fatty deposit can build up quietly inside the wall of one of those arteries, the way sediment builds up inside an old pipe. Most of the time, it just sits there, narrowing things a little, causing no symptoms at all. A heart attack happens in the moment that deposit cracks open. The instant it does, your blood does exactly what it is designed to do at any injury site. It rushes in and forms a clot to seal the crack. Except in this pipe, sealing the crack means sealing the whole channel shut, and the second that happens, the stretch of heart muscle downstream of the blockage stops getting oxygen entirely. Starved muscle does not wait patiently for rescue. Think of it the way you would think of a plant deprived of water in the middle of summer. It does not simply pause and wait for the hose to come back on. It begins wilting almost immediately, and past a certain point, no amount of water brings those particular leaves back. Heart muscle behaves the same way. Deprived of oxygen, the cells in that starved section begin dying within minutes, and here is the sentence I want you to carry out of this video. Time is muscle. Every additional minute that artery stays sealed, more of that muscle dies, and muscle that dies in the first hour of a heart attack does not grow back next month, or ever. Your heart has no spare parts department. What survives this event is what you get to keep for the rest of your life. So the entire game, the whole reason I am making this video, comes down to one question. How much of your heart can you keep alive before someone reopens that pipe? And there are exactly 3 things that decide the answer. How fast the blockage gets professionally reopened, how fast the clot keeps growing while you wait for that to happen, and how hard you force that starving muscle to keep working in the meantime. Every single thing I am about to tell you works on one of those 3 levers, and that is the part that should give you some hope in the middle of something frightening, because it means you are not helpless here. You have a hand on all 3 switches. The first thing you need is the ability to actually recognize this is happening, because you cannot act on a heart attack you have already talked yourself out of. And I hear this in the exam room constantly. People describe the classic movie version, the sudden grip your chest and fall moment, and they assume that is the only version that counts. It almost never looks like that. The most common feeling is not sharp pain at all. It is pressure, a tightness, a squeezing sensation, sometimes described as a band pulled tight across the chest or a heavy object sitting on the breastbone. It can come in waves rather than staying constant, and it frequently spreads outward, down one or both arms, up into the jaw or neck, through to the back, or low into the upper stomach, which is exactly why so many people insist to me afterward that it felt like nothing more than indigestion. Layer on top of that a cold sweat, a shortness of breath that seems out of proportion to what you were doing, nausea, sudden lightheadedness, or an exhaustion so heavy it makes no sense given your activity level, and you are looking at the real face of a heart attack far more often than the dramatic collapse. I want to say this next part directly, because I have watched it cost people dearly. If you are a woman, or if you have diabetes, your warning signs are even more likely to be the quiet kind. Women more often present with breathlessness, nausea, jaw or back discomfort, or a bone-deep fatigue, without ever grabbing at the chest the way men more classically do, and it is precisely because that presentation does not match the textbook description that women's heart attacks get misread by patients and sometimes by clinicians more often than they should. Diabetes adds its own complication, because years of elevated blood sugar can gradually dull the small nerve fibers that would normally announce pain loudly and clearly. A heart attack in a person with long-standing diabetes can be almost silent, showing up mostly as unexplained weakness, breathlessness, or a vague sense that something is simply off. The mistake I see most often with this group specifically is waiting for the pain to become undeniable before treating it seriously, when for these patients, undeniable pain may never arrive at all. Here is the rule I give every one of my patients. If something feels seriously wrong in your chest, your upper body, or your breathing, and it is not passing, you treat it as your heart until someone trained tells you otherwise. You are allowed to turn out to be wrong. You are not allowed to spend hours waiting to find out. That single mindset shift, deciding in advance that you will not require drama to take yourself seriously, is worth more than almost anything else in this video. It moves you from the person lying in a recliner hoping it passes to the person already reaching for the phone. Which brings me to the second thing, and how you make that call matters far more than most people realize. Calling for emergency help immediately is the single fastest way to shrink the total time your artery stays blocked, but not for the reason most people assume. The value is not simply getting you to a building faster. It is that treatment begins the moment trained responders reach you, not the moment you walk through hospital doors. They can place a heart monitor on your chest in your own living room, confirm what is happening, and radio ahead, so the cardiac team is already prepared and waiting before you arrive. Hospitals nationally push to reopen a blocked artery within 90 minutes of arrival, and calling early and arriving by ambulance rather than by car is what makes hitting that window realistic. There are two mistakes I see people make even while doing the right thing. The first is hesitating, telling yourself you will give it a few more minutes because you do not want to make a fuss over something that might turn out to be nothing. Let me remove that worry from your shoulders directly as a physician. Emergency responders would vastly rather be called out for a false alarm than arrive too late, and they mean that. The first hour of a heart attack also happens to be the highest risk window for a dangerous heart rhythm, the kind that can stop the heart altogether, and the vehicle coming to get you carries the one piece of equipment on Earth built specifically to correct that. Sitting at home waiting means none of that equipment is anywhere near you. The second mistake is driving yourself, or having a family member drive you. Please do not. If your heart rhythm goes unstable while you are behind the wheel, you can lose consciousness in traffic and turn one emergency into two, with no trained hands anywhere in the vehicle. Say the actual words to the dispatcher, clearly. I think I am having a heart attack. Those specific words tell them exactly which team to send and start you on real-time coaching for what comes next, including the third thing on this list. Quick favor before I keep going, because this is a natural spot for it. If this is genuinely useful to you, tap that like button. It helps this reach more people your age before the day they need it. And down in the comments, tell me if you or someone in your family has ever had a scare like this. All right, back to it. The third thing most dispatchers will walk you through, if it is available to you and nothing rules it out, is chewing a single regular aspirin. This one goes directly after the second lever I mentioned earlier, the clot that is actively growing while you wait for help to arrive. Remember what is sealing the artery, a clot made of tiny blood cells called platelets, clumping together the way they would at any wound. Except here, that clumping is happening in exactly the wrong place, tightening the seal by the minute. Aspirin interferes directly with that process, making platelets considerably less sticky, which can slow the clot's growth and in some cases keep the artery from sealing completely before professional help arrives. The evidence behind this is genuinely strong, not a folk remedy. A landmark trial known as ISIS-2, published in The Lancet back in 1988, found that a single dose of aspirin given during a heart attack cut the risk of dying by roughly a quarter. One tablet, at the right moment, mattered that much. The specifics are worth knowing precisely. It should be a regular strength, 325 milligram tablet, or the equivalent in low-dose baby aspirin if that is what is in your cabinet. Chew it rather than swallowing it whole, because chewing breaks it down and gets it into your bloodstream in minutes instead of much longer, and in a heart attack, minutes are the entire contest. I do need to draw firm lines here, because aspirin is not universally safe. Do not take it if you have a known allergy. Be cautious if you have been told you have a bleeding disorder, an active ulcer, or if you are already on a prescribed blood thinner. And if you are simply not sure, that is exactly what the dispatcher and paramedics are there to sort through with you in real time. And hear this clearly, because it is where people get themselves into real trouble. Aspirin is the third step, never the first, and never a substitute for the call. Chewing a tablet and lying back down to see if it works on its own, without ever picking up the phone, is a mistake I never want you making. The fourth thing is the one I promised you at the start, and it is the one almost nobody explains, because it has nothing to do with medicine and everything to do with what your body is doing while you wait. Think about what happens the instant you get agitated, or start moving around, or let panic take over. Your heart beats harder and faster, demanding more oxygen at the exact moment its supply line is cut. Every bit of extra work you ask of it in that window is a bill it cannot pay, and the unpaid bill is more dead muscle and a higher risk of that dangerous rhythm I mentioned earlier. So your job, the instant you suspect something is wrong, is the precise opposite of effort. Stop whatever you are doing. Sit down, lean back slightly, somewhere you will not injure yourself if you happen to faint. If breathing feels difficult, sitting upright tends to be easier than lying flat. Loosen anything tight around your neck or waist and slow your breathing down deliberately, in through the nose, out slowly. I know that is hard to do while frightened, and being frightened here is completely reasonable. But the adrenaline that fear produces pushes your heart rate and blood pressure up at the worst possible moment, and slow, deliberate breathing pulls some of that back down. If you live alone, get yourself to the front door first, unlock it, and then sit down nearby, so responders can reach you even if you are not able to get up and let them in yourself. That one small detail has quietly saved lives, and almost nobody thinks of it in the moment. The mistake I see most often here is well-intentioned but backwards. People pace, they pack a bag, they go find their shoes, they try to tidy up before help arrives because they do not want to seem like they made a mess out of nothing. Every one of those movements asks your starving heart for more than it can currently afford. There is nothing productive you can accomplish on your feet in these minutes that is worth more than sitting still and breathing slowly. Let the bag stay unpacked. Let the house stay however it is. Your only job is to be the calmest, most motionless version of yourself until trained hands walk through the door. I also want to clear up something that circulates online every so often, the idea that coughing forcefully and rhythmically on your own can somehow substitute for real treatment during a heart attack. It does not work that way for a person alone experiencing this, and relying on it instead of reaching for the phone can cost you the exact minutes that matter most. Skip it entirely. The fifth thing is for the moment none of us wants to imagine, the one where the person in front of you actually collapses. There is a crucial difference between a heart attack and cardiac arrest that people mix up constantly. A heart attack is a plumbing problem, an artery blocked while the person is usually awake, frightened, still talking to you. Cardiac arrest is an electrical failure, where the heart's rhythm suddenly goes chaotic and stops pumping altogether, and the person collapses, unresponsive, not breathing normally. A heart attack can tip over into cardiac arrest, which is exactly why every minute in this video matters so much. If someone collapses and is not breathing normally, you do not need a single day of training to help. Call for emergency help immediately, on speaker if you are alone with them, and begin pushing hard and fast on the center of the chest. Heel of one hand, other hand stacked on top, elbows locked, roughly 2 pushes every second, without stopping. You are doing the pumping their heart cannot do for itself in that moment. Immediate bystander chest compressions have been shown to double or even triple a person's odds of surviving cardiac arrest. And if there is an automated defibrillator nearby, the kind mounted on walls in airports, gyms, and shopping centers, send someone to retrieve it. It will talk you through every step out loud and will not deliver a shock unless one is genuinely needed. In cardiac arrest, the only wrong move is doing nothing at all. Let me tell you about someone I will call Walter. He is a composite of patients I have cared for over the years, so no single person's privacy is on the line here. Walter was 68, retired, the sort of man who considered it a personal failure to make a fuss about anything. One evening, he felt that same heavy pressure across his chest, wrote it off as a bad reaction to dinner, and sat in his recliner, hoping it would pass rather than waking his wife. By the time she found him grey and sweating, close to 2 hours had gone by before anyone called for help. Walter survived, and I want to be honest about that, because this is exactly where people overpromise. But he lost a meaningful portion of his heart muscle in those 2 hours. Muscle he is never getting back, and he now manages a weaker heart on a longer list of medications than he ever expected to need, feeling winded on stairs he used to climb without a second thought. A few years later, I cared for a woman I will call Margaret, also a composite drawn from patients I have treated over the years, 64, who had almost the identical evening. Same heavy pressure, same urge to dismiss it as nothing, sitting there quietly convincing herself it would pass if she just gave it a little longer. The difference was that Margaret had seen something like this happen to a friend a few years earlier, and she had decided in advance, long before that evening ever arrived, that she would not wait to be certain. She had her husband call immediately and say the actual words, heart attack. While he was on the phone, the dispatcher walked her through chewing an aspirin. She sat down at her kitchen table, reached over and unlocked the back door, and slowed her breathing until paramedics arrived within minutes, monitor already in hand. Her artery was reopened well within that critical window, and she walked out of the hospital days later with most of her heart muscle intact, back in her garden within a few weeks, a little more tired than before, but fundamentally the same woman who went in. I want to be careful with my words here, because this is exactly where people overpromise, and I will not do that to you. Margaret's heart was not untouched. There was still a small area that did not come back, and she still takes her medications every single morning without fail. But when I ask patients like her, months later, what they are most grateful for, it is rarely the lab numbers or the imaging report. It is that they still get to be the one pushing the wheelbarrow in their own garden instead of watching someone else do it for them. Same event, roughly the same blockage, 2 very different lives on the other side of it. What separated her outcome from Walter's was not luck, and it was not better doctors. It was the first 10 minutes, handled by someone who had already made the decision before the crisis ever arrived. Here is the single thread running through everything I have told you today, the one idea I most want you to carry out of this video. Every one of these 5 things works by protecting muscle you cannot get back once it is gone, either by shortening the time the artery stays blocked, slowing the clot feeding that blockage, or lowering the demand you are placing on a heart that is already starving. That is the whole secret, and once you see it that way, you will never look at chest discomfort the same way again. For years, you may have been told that chest pain or pressure is simply a signal, something that happens to you, entirely out of your hands. It is more than that. It is also a lever, and the first 10 minutes after it starts have your fingerprints on them more than any cardiologist's. You did not cause a blocked artery by being careless, and heart disease at this stage of life is usually the slow sum of decades of factors well outside any single decision. But what you do in the minutes after it starts is entirely yours to control. And now, the line I promise you in every video I make, the one that matters most here especially. There is a point where this stops being something you handle from a recliner and becomes strictly a professional matter. No exceptions. If you have known heart disease and have been prescribed nitroglycerin or another emergency medication, follow the specific plan your cardiologist already gave you and do not improvise a new one from a video, mine included, because getting the timing or the dose wrong can be dangerous in its own right. If you have any doubt at all about what you are feeling, this is never a moment to wait for certainty. Bring it straight to emergency responders and let trained professionals sort out the rest. So here is exactly what to do. Starting tonight, 5 simple steps. 1. Keep a bottle of regular aspirin somewhere you and anyone you live with could find in the dark within 10 seconds and check that it has not expired. 2. Make sure your house number is clearly visible from the street, in daylight and at night, so responders are not wasting minutes hunting for your door. 3. If you or someone in your household already has heart disease, know exactly where the medication list and medical records are kept and make sure more than one person in the house knows. 4. Have an honest conversation this week with the people you live with about what a real heart attack looks like and what the plan is, because the moment it happens is not the moment to be learning any of this for the first time. 5. And this ties everything together. Decide right now, before you are ever tested, that you will not require drama to take a warning seriously. That decision, made in advance, is the difference between Walter's evening and Margaret's. It costs you nothing tonight, and on the night it matters, it is the only thing standing between you and hours you can never get back. Now, everything I have covered today protects the muscle you already have. But there is another number most adults over 45 have never actually had checked properly, one that quietly predicts a first heart attack years before it happens. In my next video, I am going to walk you through exactly what that number is, what it should be at your age, and the specific questions to bring to your next appointment to make sure somebody is actually looking at it. I will see you there. Take good care of yourself, and take good care of that heart of yours. I'm Dr. Robert Lawson.